bilang ng mga kaso natin. Mula pa po last week, walang tigil na po ang text at tawag sa amin ng maraming tao. Nagtatanong, ano daw ba ang hakbang na gagawin ng HPAAC? Magtatawag po ba ulit kami ng timeout? This question is being asked us amidst a raging debate over the possibility of another lockdown. A move which our economic managers say can spell doom for our economy that is on the verge of collapse. Pag tiningnan po natin ang ating kalagayan ngayon, para na naman tayong namimili muli between buhay at kabuhayan. Ano nga ba ang dapat? Mag-lockdown ulit para mapigilan ang pagdami ng kaso ng COVID at mamamatay dito? O hindi mag-lockdown dahil marami na naman ang magugutom? Dahil walang-wala na po talaga tayong paghuhugutan pa. Ano nga ba ang tama? Napakahirap na tanong, pero kailangan nating sagutin at pag-isipan ng mabuti kung ano ang mga hakbang na dapat nating gawin. So kami po sa HPAAC ay nag-isip. Kaya pa ba nating mapigilan ang pagdami ng mga kaso? Kaya pa ba ng mga healthcare workers ang dami ng pasyente sa mga hospital? Kaya pa bang mag-hold on ng ating healthcare system? Parang sa ngayon sabi nila, kaya pa naman. Pero hanggang kailan ito kakayanin? Kami po sa HPAAC ay naniniwala na kung magtutulong-tulong tayo ngayon, simula sa araw na ito, para ayusin at gawin ang mga simpleng bagay sa darating na mga araw, may pag-asa pa po na mapipigilan natin itong rumaragasang surge nito. Kami din ay naniniwala na mali po ang tanong kung magtatawag po ba kami uli ng lockdown. Pagkos, para sa amin, ang mas magandang tanong sana na gusto naming marinig ay ito. HPAAC, ano ba ang pwede nating gawin para mapigilan natin ang surge? Para hindi tayo umabot muli sa lockdown. Ang sagot po namin dyan ay ito. Kami po ay nananawagan. Kami pong mga nagkakaisang healthcare professionals ay muling nananawagan sa ating mga kababayan, mga leader sa lokal na pamahalaan, sa mga business and industry leaders na magtulong-tulong po tayo na makagawa ng mga paraan upang ang bawat Pilipino ay maging ligtas sa pandemyang ito. Di po mahirap ipatupad ang aming mga suwestyon na ibibigay ngayong umaga. These are low-lying fruits. For business and industry leaders, request po sana namin kung pwede po nating ma-decongest muna ang ating mga workplace. Bawasan po muna natin ang mga pumapasok para po mabawasan ang tsansa ng hawaan sa ating trabahuan. Specifically, we're asking you to reconsider or allow work-from-home arrangements for employees whose services can be rendered using this arrangement. At kung pwede din po, if we can implement staggered work hours para hindi po sabay-sabay ang pasok ng mga trabahador po natin nang sa ganun po ay hindi sila magsiksikan sa bus, jeep at MRT. Pwede rin po sana paki-improve ang ventilation sa ating mga trabahuan. Malaking tulong po ito para mapigilan ang pagkalat ng COVID in the workplace. And lastly, intensify apat dapat in the workplace. To our local chief executives at the provincial, city, and municipal levels, we appeal to you to impose granular lockdowns in your locality the moment that you're able to detect the earliest sign of an outbreak. Capacitate your berths, increase the number, and improve the quality of care in your isolation and quarantine facilities. Gayahin po natin ang Pasig, Valenzuela, Mandaluyong at Antipolo with their coordinated contact tracing system. It would allow for ease of contact tracing without impeding movement ng mga kababayan natin sa loob at labas ng LGU natin. It will promote and facilitate smooth inter and intra-LGU movement. And while we are on the subject of movement, let us take efforts po to support active transport. Address transportation needs of your constituents by accelerating the establishments of pop-up bike lanes. Create open spaces for business and leisure activities. Buksan po natin ang mga park, huwag po natin silang isara. Magbukas po tayo ng mga open market, alfresco restaurant, and even open-air concerts. At kung pwede din po, wag lang po muna nating payagang magbukas ang mga publikong lugar na hindi po maganda ang ventilation o air circulation. Pwede rin pong limitahan natin ang mga tao dito hanggang hindi po nila naaayos ang kanilang ventilasyon. And lastly, for the time being, while we are in this surge, can we also ask you to discourage dining in enclosed spaces lang po muna. Mag-take out lang po muna tayo to show support to our local businesses in the food and restaurant industry. At pag nagawa na po nating lahat yun, hindi na po kaming mahihiyang muling kumatok sa puso ng bawat Pilipino to strictly follow and observe 4 dapat. Bagong virus variant, parehong pag-iwas. Bagong surge, parehong pag-iwas pa rin. Observe 4 dapat sa lahat po ng pagkakataon na pwede po natin itong magawa. Kung hindi po kaya ang 4, ang 3 ay sapat to decrease your risk of getting the infection, developing disease, and preventing death in 90% of the time. Pag ginawa po ito natin, we can protect our family and loved ones from COVID and mitigate this surge and lockdown. Stay at home lang po muna tayo. Ang taong bahay sa panahon ng COVID surge ang siya pong totoong bayani. Ipagpaliban muna ang paglabas-labas kung hindi naman po importante o hindi kinakailangan. Huwag lang po munang mag-reunion, no to mass gatherings, fiesta, sabong at iba pa. Kaya po natin ito. Tulad po ng sabi ng ating Pangulo, marami na po tayong napagdaanan na hirap. Ngayon pa ba tayo bibitaw? At para po sa mga nagtatanong, opo, naghahanda din po ang HPAAC ng sulat para kay Presidente Duterte. Tulad po ng bilin niya sa amin na huwag po kaming mag-atubiling sumulat sa kanya para idulog po ang ating mga hinaing, suwestyon at rekomendasyon na malugod naman po niyang tinanggap sa nakaramaang mga araw. Patunay po dito ang pagpirma niya ng executive order to amend and para po magkaroon ng liberalization on the internet access. Yan lang po ang aming masasabi sa umagang ito. Maraming salamat po sa inyong pakikinig at muli magandang umaga po sa ating lahat. Salamat, Dingdong. Over to you.
Maraming salamat, Eileen. Thank you for explaining what HPAAC is asking for at this time. No? So, hindi po kagaya nung last year, hindi naman tayo humihingi ng timeout or lockdown. No? Hindi po ito yung panahon ngayon. Pero sa nakikita po natin na surge na nangyayari, kailangan po nating mag-ingat. So, are there any questions from the press? Wala akong nagbigay ng question sa ating chat box. I think because they are recording the proceedings now. Red Mendoza, you might want to ask your question. You can unmute your mic.
Yes po. Hi po, good morning po. First off, ngayon po, there is a big contentious debate about going to lockdown or not. Kasi some local officials said na lockdowns are not necessary. Like for example, Cebu, Governor Gwen Garcia said hindi siya magpapatupad ng lockdown even during the time na tumaas yung kaso niya sa province niya and yun nga, may mga virus na na-discover doon. Others naman had to resort to, yun nga, curfews, the Metro Manila Council, and yun nga, liquor ban. And some businessmen I've talked to or told me na they hate the imposition of liquor ban and at the same time parang hindi naman po yata kailangan ng curfew. Parang it's not anymore necessary? Parang hanggang curfew na lang ba ang solusyon ng local government units natin, liquor ban? How can you respond to this na parang hanggang ngayon nagdedebate pa rin tayo about doon sa context ng why do we have to do these measures? Kasi hanggang ngayon ang dinadahilan pa nila is masisira pa yun, masisira economy namin or masisira yung business namin or mababagsak economy namin Although the notion is we had to do these measures to control the surge, increasing cases, pero hanggang ngayon hindi pa rin yata nare-realize ng tao na important itong mga measures na ito.
Can I respond, Ding Dong?
Sure, sir.
Can you hear me? Thank you, Red, for that difficult question. I think what LGUs need to understand is that many of our strategies are double-edged swords. No? For example, ang curfew, intindihan naman natin kasi ayaw nilang lumilibot ang mga tao sa gabi, nagiinuman at dahil pwedeng manggaling dyan ang surge, no? Partly from activities like that. Kaya lang, meron ding bad effects. It limits the number of hours that people have to travel, no? Tapos it limits the number of hours that people have to work. So imbis na sana, one of our proposals, sana staggered na yung work hours, no? Merong morning shift, merong evening shift. It will allow people to distance themselves at work and decongest the workplace. Pero paano natin yan gagawin kung ginawa yung curfew hours at limited na ang travel time? So maybe we should think twice about those curfew hours. Yung closing parks, halimbawa, sarado ang UP Diliman, sarado daw ang Makiling, UPLB. We need open space kasi it's when you're in open space, it offers more than 90% protection from transmission. So when ang baliktad ng ginagawa natin, yung open space, we close it. Yung closed space, open. So we allow people to go into restaurants and closed space, but we don't allow them to go to open parks with open space na doon safe talaga pumunta. So many of the interventions have a good and a bad effect na dapat isipin ng ating LGU. Tingin namin open space, closed space, broaden travel and work hours, do not narrow it. Yun lang po. Thank you.
Thank you very much, Dr. Dance. May iba ka pang tanong, Red?
Yes po. Last question na lang po siguro on my end. How are we facing right now sa mga variants na ito? I mean, of course, we all know na still minimal. Konti lang yung mga nasi-sequence natin because we all know genome sequencing is very difficult to process. It takes weeks. It takes a week. Pero how are we going to measure right now yung response natin in the face of increasing cases of the B117, B1351, and yun nga, yung sinasabi nga natin P3 variant? Should we measure the same response then in the face of the emerging variants, lalo na kung sinasabi nga nila baka nga raw yung variants ang rason kung bakit tumataas yung mga kaso? Yun lang po. Salamat po.
Dr. Espina, you'd like to answer that question?
Good morning, Red. We meet again. How are you? Thank you for that question. No? As I've shown kanina, pinakita namin sa slide, bagong variant, pareho pa rin. Apat dapat pa rin ang pwede nating gawin. Okay? It doesn't change. The mode of transmission didn't change. It's still being transmitted in the same manner. So kailangan lang talaga consistency sa pagpapatupad ng ating mga preventive measures. The same preventive measures still apply despite the presence of these variants. Kailangan lang maging mas stricto tayo at maging consistent sa pagsunod sa mga minimum public health measures.
Thank you, Dr. Espina. Siguro at this time I'd like to call naman Miss Maki Pulido. You can unmute your mic, Maki, and then ask your question.
Good morning, doctors. Kasi magho-Holy Week na in a few weeks, tapos marami ng tourist destinations na open and bumaba na rin yung mga restrictions, binawasan na yung restrictions, and traditionally, Filipinos talaga go outside of Metro Manila. So I just want to ask for your opinion about this. What's your advice? What are your fears? Kasi malapit na ang Holy Week in the midst of this surge.
Okay, anyone from the steering committee who would like to answer that? Sorry, I cannot answer kasi hindi po ako nag-Holy Week. Dr. Dance.
Maybe I can start the ball rolling, ding dong ya. Nakakatakot talaga ang mass gatherings in whatever form, whatever religion. And we need to control this, no? Siguro ang katumbas nito sa ibang bansa, yung electoral campaign sa US, no? Mass gatherings yun eh. So mass gathering for any reason should be discouraged, especially with this current surge, no? Alam nyo, pinakita ni Dr. Espina yung rise in cases na nakakatakot. Usually, 2 to 3 weeks after that, makikita natin yung rise in deaths. And when that happens, in 2 to 3 weeks, parang tapat na tapat tayo sa Holy Week. Pwedeng ma-overwhelm yung ating healthcare system. No? Ang layunin po natin sa pandemic na ito, hindi gawing zero ang kaso. No? Hindi natin kaya yan as of now. Ang layunin natin, huwag lumampas ang dami ng kaso sa kakayahan ng ating hospitals and health services. Kasi pag lumampas dyan, halimbawa napuno na no, yung ating hospitals, dadami na talaga ang mamamatay. As of now, in Metro Manila, doon sa mga COVID referral hospitals, 80% full na ang ating ICU beds. 80%. We are at an intense alarm level doon sa COVID referral hospitals. So, while sila pa lang naman ang nanganganib at napupuno, pag napuno na yan, mapupuno na rin ang level 1, level 2, level 3 facilities natin. And mangyayari na naman yung nangyari last year na people are dying in emergency rooms and unable to be admitted. So ayaw natin umabot sa ganon. And the best way is to stop that kung saan nagsisimula. Doon sa mass gatherings. So we call on the public to celebrate Lent in the way it should be, in an austere setting. Sakripisyo ho tayo, part of our Lent. Pwede naman yun, di ba? Let's have sacrifice and stay away from mass gatherings. Yun hong panawagan ng Healthcare Professional Alliance. Salamat po.
Doc, clarify ko lang po, stay away from mass gatherings, from resorts also that promise na maluwag naman, like beaches, nasasabihin nila open air naman, and even in places na before ka papasok, meron naman daw, they ask for tests like antigens or RT-PCRs.
Well, yeah. So, yung you can go to a place and not have a mass gathering, di ba? So, what we're specifically discouraging is mass gatherings. No? So, kung you will need to be very careful about the place you go. Kasi a beach is open space. And as we said, we encourage that open space. Wag isara yun because these are safe places to go. But you need to be on the alert. Kasi when these open spaces fill up, no, na rin yan, parang nagiging enclosed place na rin. No? for example, kami, we tried to walk around in looking for open space, to be able to walk at least. We went to Marikina River the other day. Punong-puno. So we had to go back and step back. So going to a beach or an open park is not guaranteed that it will be protected. So we need our policymakers to open space, but to regulate the number of people that are able to go into those open spaces.
Doc, but how about the resorts na talagang in-encourage ng magbukas? Is it also safe? Kasi yan yung mga pupuntahan maliban sa mga relatives, which will be parang mass gathering na rin, di ba, pag uwi sa probinsya. Pero yung how about the resorts na pupuntahan ng mga local tourists?
Yes, yes. So I guess my short answer is, as long as regulated yung number of people going to those resorts, then we should be okay.
Sir Tony, if I may add.
Yes, Eileen.
Thank you, Maki, for that very timely question, kasi talaga namang parating na ang Holy Week. And we, as a tradition, sabi mo nga tayo mga Pilipino, naging tradition na hindi lamang magpunta sa resort, kundi magbisita iglesia at iba pang mga activities related to Holy Week. Ang ano lang po sana namin is tayo po ay maging maingat at we have to be conscious in observing pa rin po yung apat dapat. Kasi when we travel to the resort, isipin po natin, how do we get there? Do we take a public transportation? Do we travel together? Sino-sino po yung mga kasama natin? Ano po yung mga health status nila? At pagdating po natin sa resort, we will be interacting with locals, etc. Are we going to be interacting with them? So we have to plan all of those things before we decide to go on that trip or on that activity or planned vacation. Naiintindihan po namin na this is also one way to distress, and this is helpful for our mental health, na pumunta po tayo sa isang lugar na tahimik, kung saan tayo po ay makakapagmuni-muni at mag-commune po tayo sa ating inner selves and renew our faith. We understand that. But at the back of that, we also need to be careful kasi nga we are in the middle of a surge. So, yun lang po. Yun lang po ang paalala namin. At the end of the day, kayo po ang magdidesisyon para sa sarili nyo at sa pamilya nyo. Magbibigay lang po kami ng mga paalala.
Dr. Inday?
Ipaalala lang natin kasi yung mahal na araw, nung araw, bawal talagang umalis ng bahay. Walang tao sa daan kung may mahal na araw. Kaya lang nitong mga nakaraang mga taon, ang mahal na araw natin bakasyon na, 'di ba? Kaya lahat nasa resort. Ang talagang sinasabi noon sa atin bawal lumabas, lalo na pag Good Friday. Kaya dapat siguro ibalik natin ngayon 'yon dahil mag-quarantine lahat at mag-stay lang muna sa bahay.
Yes, Dr. Bambi.
Thank you, Ding Dong. Maki, hi. This is Dr. Kasala, Bambi. Na pag-usapan ng Holy Week. Oo nga, Inday, ang Holy Week celebration dito sa Pilipinas ay hindi na very holy kapares nung araw, no? So, medyo kailangan din nating paalala sa mga publiko, no, na what the Holy Week is all about. But there are some naman who actually want to combine family bonding vacations with religious observations in the nearby churches, no? So that can also be done. Yun na nga, gaya ng sabi ni Eileen, kahit ano pa hong gawin ninyo at kahit saan pa kayo sumipot, apat dapat lang po dapat, no? And as far as safety in the resorts are concerned, there are some provinces who have actually put up their own Visita app Visita, VISITA. Baguio is one. Zambales, I know, is setting up one, but they're just on the trial run. So they're hoping to put it up before Holy Week because everything na ginagawa ng turista or kailangan magmisita sa probinsya na yon will have to pass through that visita system, including registration of the tourists who are going in, kung ano yung transportation. Kasi at least for Zambales, because that's what I read on, wala pa hong public transport available. So they will actually ask kung paano kayo aabot doon at paano kayo magta-travel doon sa mga iba-ibang cities when you reach the main city in Zambales kasi wala ngang pag-ikot, no? Pang-ikot doon. So, and then the resorts naman, they all say that the DOT accredited resorts lang ang pwedeng puntahan because nga parang they go through a series of seminars also to find out how they can actually sanitize and how they can keep the resort safely for all the tourists and how much capacity they can only accept. Some resorts I know require the RT-PCR test. I think it's the saliva test on the day itself. So medyo ang hirap, di ba? On the day itself, paano yon? Apparently, they also have that kind of facility in their resorts. So for a fee, of course. So naging business na rin yung additional yata, yung pagte-test. But some do require that test at least mga 2-3 days prior to coming in. So if we practice apat dapat and we check on the provinces kanya-kanyang way of keeping safe, then perhaps the Holy Week vacation in open spaces will be safe enough for all. For as long as we remember that what Tony said, no? If everybody goes to that particular space, kahit open siya, mafe-fill up din. So, kailangan din nating i-consider yon. The reason why I know about Zambales was because, yes, beach na po kami. And it's our Holy Week na ito lang po ang panahon na talagang pwedeng malibre ho lahat kami. Kaya Holy Week has always been a mix of vacation and religious observation for our family. And it's also my birthday week. So talagang beach na ho kami. But yun na nga, I found out all these things and then nag-upsurge pa. So we have already kami mismo we have already decided na stay home muna kami. Meron ho kaming malaking plastic pool. Yun na lang po ang gagamitin namin sa garden kasi open air. And then kami lang ho, same household. Wala ho kaming problema, wala ho kaming pinupuntahang ibang mga lugar. So I think if everybody took that kind of thinking, then we will all be safe and maybe perhaps prevent another upsurge or this upsurge going even higher. Yun lang. Thank you.
Thank you, Dr. Bambi. Before I call Sofia Toma Cruz, followed by Greg Gregorio, I'd like to call on one of our steering committee members, Dr. Lay Alfonso of the Philippine Society of Public Health Physicians. She has something to say about the churches.
Yes, thank you so much, Maki, for that important question. In fact, last night, after our meeting, there was a distress call from one of my friends in the province. There was a positive case who went to a choir practice. The whole of the choir was exposed in an enclosed space. So what are we saying here? We are in the middle of a surge, and there are people who have been knowingly exposing their friends, people, to this virus. So perhaps while we are also asking the government po, kami po ay nananawagan sa mga lugar na maaring pangyarihan ng isang super spreader event. Kung maari po yung ating mga liderato, yung mga leaders natin, lahat tayo po magtulong-tulong muna po sa panahong ito upang panatilihing ligtas ang bawat isa. So siguro po yun lang po sa churches at siguro maganda magkaroon din ng ibang panayam or iba pang diskusyon tungkol po sa mga settings na pwedeng maging super spreader. Thank you po.
Sophia, you have a question?
Yes, hi, good morning. I just have a couple of questions. First, being on the suggestion for LGUs to implement localized lockdowns right away. I think one thing, I mean, that's something that we've seen taking place over the last few weeks, but the number of days, for example, in those localized lockdowns, whether it be barangay or condominium units, buildings vary. So from 2 to 3 days or other durations of time. I was just wondering what your recommendation of this would be, or if those are still useful, and if so, what would be a good time frame to implement those localized lockdowns? That's just yun lang muna, and then I'll ask follow up after.
So who would like to answer that?
Okay.
Tama ba?
Okay na po, ma'am.
Oo.
Yes.
Kasi ako, Ding Dong. I think yung mga localized lockdown, each of the LGUs need to monitor their own communities, no? It's hard to say na okay, yung localized natin is only for 1 week or even for 2 weeks. Really depends on how big the outbreak is and how efficient is their contact tracing. Kasi kung hindi nila makontrol yon within those time span, they need to extend those lockdowns. So that's why siguro yun yung use nung localized regulations, no? Kasi yun talaga, sila dapat yung magde-decide if they're able to control the outbreak already. So there's really no strict rules on how long this lockdown should be, but each of those LGU should be able to assess, kasi mayroong mga surveillance naman sila na units and epidemiology units within its municipality or within each LGU, and they should assess that. Yun ang natin. Kaya lang in NCR, ang problema natin is people are transferring from one place to another, so that makes those kinds of lockdowns sometimes not as efficient as you want it to be. Ding Dong, can I just add something about yung apat dapat?
Sure
Kasi,
po.
kasi hindi masyadong natin na-explain yata how it works. Parang people just think of it as, a set of rules that our community or each individual should follow. But how it works is dapat wherever we go, kumari may binukas na resort o may binukas na mall or whatever, kung saan man pupunta yung individual, they have to check kung they're able to do the 4 measures that we had mentioned, no? Yung ventilation, yung ating physical distancing, yung masks and shields, as well as yung duration of the interaction. So kung hindi nila magawa yung apat, at least 3, parang pwede na, no? Pero kung 2 lang, wag silang tumuloy. Wag gawin yung gagawin na yan. So yung pagkain, kung magre-restaurant tayo, sigurado tatanggalin natin yung mask. So bawas na ng 1. So hindi na pwedeng mawalan yung 3. Kaya ang sinasabi namin, kung enclosed space, tas tatanggalin mo yung mask, 2 lang yun. So hindi na yan pwedeng puntahan. So dapat ganun tayo ang paggamit ng apat dapat. So we need to plan and think ahead kung saan man tayo pupunta. Kahit pinayagan, bukas na yung mall, bukas na yung gym. Kung hindi mo magagawa yung 4 or kahit na 3, kung 2 lang, huwag ka nang pumunta. Yun.
Follow-up question, Sophia?
Yeah, thank you po. Just on the point about active transport, I recall from what happened last year is that the group also met with a lot of different government agencies, and in particular about 7 issues in particular now that were brought up. One of them still being active transport. I was just curious to know if what happened there with the group's proposals, if if the agencies you spoke with were was there any follow-up there, or how come these weren't implemented yet? in particular about, I mean, aside from the bike lanes and everything, I remember there being a suggestion also about contracting more transport so we can decongest other transportation like trains and buses. Yeah.
I'll answer, Sophia. Thank you for that question. Ano. I'll answer from the point of view of the healthcare sector. And then Ms. Keisha Mayuga, one of our transport experts, is with us today, who can help answer. From the point of view of the healthcare sector, it's a very big problem kasi yung mga doktor and nurse and midwives and other workers, they put themselves at risk by going to work. Tapos, on the way to work, at risk din sila because many have resorted to biking. In PGH, for example, last I heard there are 800 healthcare workers who bike to work. And punong-puno yung aming parking lot ng bikes. And we've heard of at least, ewan ko kung dumami na, 1 doctor and 1 nurse who died on the way to work, biking, di ba? So we put ourselves at risk during work, we put ourselves at risk on the way to work. Kaya napaka-importante ho yung panawagan for active transport. Nagkaroon na ng bayanihan to allocating, I think, around 1 billion to active transport in the major cities. Pero parang ang konti pa ho nang nangyayari. And we feel this can be sped up. I turn the floor to and introduce to you Ms. Keisha Mayuga, which I'm sure many of you know because she's an active campaigner for active transport. Keisha, please.
Thank you, Dr. Tony. Actually, yes, I'm part of Novus One, and we are really advocating for 2 things. One is the promotion on really fast forwarding active transport. Kasi yun nga, tulad ng sabi ni Doc Dance, marami ng healthcare workers and other essential workers who have turned to cycling kasi it's unsafe. If you've seen the public transport system now, linya-linya na sila eh. Kahit ngayon, parang it's even like pre-lockdown and the capacity has really shrunk from pre-lockdown. So our 2 causes really, 1, to promote active transport by asking the LGUs to put up pop-up bike lanes, which some LGUs have done, but I think we need to do more of these, especially now, because it's one of the safest modes of transport. Kasi open air, and healthcare workers are also don't have to depend on the times of public transport, etc. So that's one. And then the second one is service contracting, which is more on providing more public transport supply so that there will be no crowding in waiting areas or in public transport itself. So so far there has been progress naman. It's been in the Bayanihan 2 budget. But what we're now asking, what we can ask for to prevent the surge from getting worse is to fast track it and ask the LGUs to really implement their pop-up bike lanes now, and for the service contracting to move faster, in a faster pace. Kasi the more people need to get around, the more they'll be crowding in the public transport areas and they won't have options to, imagine if your healthcare working option mo lang is maghintay sa pila na maraming tao and wala na yung sapat dapat kasi sobrang crowded, or bike on the street where it's not safe for them. So those are really the 2 things that we can ask for our LGUs and our government agencies to fast track. So yun. Doc, Eileen, go ahead.
Thank you, Keisha. No? So, ibabalik ko lang po. Ang lahat po ng mga bagay na pinag-uusapan natin ngayon, these are all recommendations na pwede na po nating magawa ng ngayon para po mapigilan po natin ang patuloy na pagtaas ng mga kaso natin sa COVID. Kaya ito pong lahat ng ito ay panawagan para po ang mabawasan po natin ang kaso through preventive measures. So, Ito po ang magagawa natin sa LGU. Ito po ang magagawa natin sa workplace. At salamat, Maki, no? Napag-isip kami, baka kailangan din namin makipag-usap sa simbahan at sa iba pang mga grupo. At tulad ng sabi ni Sir Tony, magre-report kami, yung 7 na hiningi namin nung August, meron naman pong nagawa. Meron namang na-achieve. Nagpapasalamat po kami na pirmahan nga po yung internet connectivity. Isa po yun sa napakalaking hiningi namin noon. Ngayon po, ang challenge natin is, paano natin magagamit ang internet connectivity na ito sa digital contact tracing. Kaya yun din po ang hinihingi namin sa LGU. Sabi ni Ma'am Bambi, ang mga LGU may mga app. Totoo po yun, ang mga LGU mga app. May mga app na po. May mga digital contact tracing systems. The challenge now is, paano natin sila bubuuin para sa isang national contact tracing system. Makakatulong po yun ng malaki. And LGUs can also take measures to reduce crowding. So yung 3 C's po natin, avoid crowding, avoid close contacts, and avoid enclosed spaces. Pwede po natin magawa yung lahat. So can we go now to the next question? Ding Dong?
Okay, someone wants to ask a question. Yung susunod po natin si Greg Gregorio.
Good morning po, doctors. Ma'am, clarification po dun sa sinabi natin kanina that para na naman tayong namimili muli between buhay o kabuhayan. Seeing the recommendations, are we saying that at this point, we have no option but to compromise? Kasi last time, we called for a break para sa kapakanan ng ating mga health workers, but at this time we're kind of more choosing the economy. Tama po ba?
No, Greg, we are not choosing the economy over life. Because hindi pwedeng mamili between buhay at kabuhayan. They go together. Ang buhay at kabuhayan ay magkaagapay para sa bayan. Noong August, nag-call kami ng timeout because we were really so overwhelmed. The healthcare system was so overwhelmed that we feel kailangan nating mag-regroup and to come up with a new strategy for doing things. That's why we came up with the 7 points na recommendations. So ngayon, it's not na we're shrinking away na sinasabi, lockdown is still an option. Lockdown is still an option. Kung umabot tayo sa punto that the healthcare system is really overwhelmed beyond its capacity to effectively address the COVID-19 cases. But at this point, we feel na meron pa tayong pwedeng magawa to mitigate the surge. How long can we mitigate this? It depends on us doing all of these things together. That's why we're having this press con. I hope it's clear, Greg.
Yes, ma'am. Ma'am, follow up na lang din po. Kasi we are also saying na amid the detection of different variants na sabing mas transmissible, we are also saying that variants may have driven the surge, pero the primary cause still is the breach to the compliance with the minimum health standards, like the use of face mask and face shield. Pero there are people, mostly sa Twitter or sa social media, saying na we've been following everything. We've been wearing mask, face shield, pero bakit parang kami na naman yung may kasalanan? And people are and they are saying parang parang sinisisi ba kami dahil matitigas ang ulo namin? Maybe I just like to get the point of view po of the health professionals na lang po. Thank you, ma'am.
Okay. If I may respond, Greg, the whole point of Dr. Espina's presentation in the HPAAC conference, and I'm glad you're bringing it up, is this. Let's stop blaming the people. They're doing everything they can to comply. Kaya lang, we force them into crowds, di ba? We force them into enclosed space. We force them into situations where they cannot follow those 4 rules, yung 4 dapat. And so, our call is mainly to the LGUs and the business establishments to to help the people comply. Kasi pagod na sila na trying to comply and they are forced into, kita mo naman napipilitang pumila ng siksikan, sumakay sa siksikan, pilitang magtrabaho sa siksikan, waiter sa mga enclosed restaurants. We need to open up opportunities for them to protect themselves. That's our whole point. And I hope that the press pays sufficient attention to our appeal to the business establishments to improve the work situation, and our appeal to the LGUs to improve the situations in communities. Yun na nga yung mga nabanggit, enabling active transport, opening up open space where businesses can form.
All right, sir. Thank you po, Dr. Espina, Dr. Dance. Thank you po.
Thank you for bringing that up again, Greg, because that is our main point today.
Okay, I'd like to call Lianesca Panti from GMA News Online.
Morning po. Hello.
Yes,
Okay
please
po.
ask your question to you.
Okay. Good morning po, doctors. Ang point, dugtungan ko lang siguro in relation to what Greg asked. Kasi parang every time I call for improvement or recommendations from experts and doctors, nurses, health groups, parang laging targeted on people. You should do this, you should do that. I'm curious, what are your recommendations for the government specifically on securing vaccine supply and implementing the vaccination program? Because undeniably, vaccine is part of addressing COVID. So parang ano naman yung recommendation po ninyo for the government? Kasi parang ang nangyayari, it's always the people who are adjusting, complying, and everything. Pero yung vaccine natin, tayo yung last na yung vaccination program, we are the last to start in Southeast Asia. 1.12 million doses pa lang yung meron tayo as of the moment for the last 16 days. So is this acceptable from, I'm curious, is this acceptable from your standpoint na yung vaccination program natin ganito pa lang? And you know, because of this situation, people are forced, yun nga, to, you know, be stuck in the house again, and you know, doble ingat, sila na naman yung nag-adjust. So I'm curious, how would you make recommendations in that aspect of government response po yung sa vaccination?
Ding Dong, may I respond quickly lang? No?
Yes,
yeah. Important yung vaccination. It's not the main topic today, but I think it's a good question kasi we're facing a surge, and it's one of the strategies to control the surge. And dyan din, we want to change the narrative. No? Hindi dapat ang tanong, bakit tayo nahuhuli? Kasi yung how soon we start is not so important. Iba-iba dapat yan for every country. Iba-iba ang ating economic situation. Iba-iba ang ating legislation, existing legislation on approving the vaccines. Iba-iba ang ating experience ng mga tao, no? Yung culture natin. Hindi naman nangyari yung dengvaxia in other countries, no? Where there was a lot of loss of trust because of what happened. So iba-iba ang situation. Ang gusto namin sana, hindi natin laging sinasabing kulelat tayo at why didn't we start sooner. Dapat ang tanong, how fast can we deliver it? Yung when we start, but how fast can we give it? Even if we start in September, but we can deliver it to many people in 3 months, that's better than starting in March and taking 1 year or 2 years to deliver it, because the speed at which we are able to transmit or to vaccinate everyone is very important, no? Kung mag 3 years tayo bago tayo makabakuna ng marami, di by the time nakabakunahan natin yung huli, sensitive na naman yung nauna, no? So let's change the narrative and stop looking at ourselves as kulelat, no? let's try to have a speedy vaccination program. Yung do it right. Let's not do it fast. Let's do it right.
Okay, Eileen.
Lianesca, your question is valid, but sa ngayon, this is what I can say. The vaccines will not address the current surge. Hindi natin magagamit ang bakuna para sa surge na ito ngayon. Kasi nandyan na siya. And kahit magbakuna tayo ngayon, it will take time for the bakuna to take effect. And secondly, yung bakuna na meron ngayon does not prevent transmission of infection. It prevents disease. It will only protect people from manifesting signs and symptoms of the disease. Pwede pa rin tayong mahawaan. Okay? So, yun lang. So, ibabalik ko ulit ang usapan natin. Ano yung pwede nating gawin para maapula ang sunog na to, kung sunog man ito, itong surge na to. So, let's focus lang po muna. Napakalawak po ng usapin tungkol sa COVID, nagsasanga-sanga. But wag po tayo sanang mabilaukan by trying to solve all of these things in one sitting. Let's do it one step at a time. Yun po ang natutunan ko sa disaster. Let's do it one step at a time. Dahan-dahan lang po. I hope it's okay, Miss Panty, for na focus muna tayo sa surge, if okay, with everyone.
Okay, next, Mr. Rafael Bosano, you would like to ask a question? You sent a message at the chat box.
Hi, good morning, doctors. Tungkol lang po sa reimposition ng curfew dito sa NCR, gaano kalaking impact po yung nakikita ninyo dito in terms of the number of cases, and by when can we see the positive effects? Kasi po, tsaka baka meron kayong reminders that it doesn't, it's not a stand-alone measure, no? Kasi baka isipin ng iba, curfew alone is enough.
So who would like to answer that, Eileen? Parang nabanggit na kasi kanina, di ba, na staggered work hours. So hindi naman curfew yung nakikita ng HPAAC na solution. Kasi pag nag-curfew ka, hindi mo masastagger yung work hours.
And pinakita din namin kanina na marami talagang kailangan. Hindi siya kayang isolve ng isang action lamang tulad ng curfew. So, hindi po namin sinisisi ang mga tao. Inuulit ko po yung sinasabi ni Dr. Tony, hindi po namin intensyon na sisihin ang sino man. Because we know na ang actions towards the prevention of COVID, controlling the spread, is at both personal and institutional level. Hindi po ito kayang gawin ng atin lang, individually, at hindi rin po ito kaya ng gobyerno na sila lang. Kailangan po talagang magkatuwang. Kaya po paulit-ulit naming sinasabi yung apat dapat, but now we are expanding it to say, apat dapat, let us create an enabling environment in our LGU, in our workplace, and in other settings na para po makapag-apat dapat ang mga tao. Yun lang po. Yun po ang gusto naming sabihin.
Okay, Tristan Nodalo from CNN, please ask your question.
Hey sir, hi po. Hi sir and ma'am, good morning po. Question ko lang po, just a follow-up, although sinabi na po natin kanina earlier na wala ngang request for a timeout. But I just want to ask, ano pong threshold natin to say that it's already time to ask for a timeout? Meron po bang certain, kasi sabi ni Dr. Dance kanina, at least 80% na yung mga napupuno na ICU facility sa Metro Manila. Pero ano po yung gauge natin to say na, okay, this is parang ito po yung panahon na we will ask the same request again? Yun lang po.
Well, quick correction lang ha. 80% of COVID referral hospitals. Yun yung, 80% ang occupancy ng ICU sa COVID referral hospitals. It's not metro-wide ICUs, no? Ang metropolitan-wide ICU occupancy, I think, is only 50%. So merong statistical basis, Tristan, for na sinet ang IATF. I think it's 85% is an ECQ, considered an ECQ level of ang occupancy ng healthcare facilities natin. Pero kami naman, our advantage sa HPAAC is we also have the ears on the ground kasi many of our members are frontliners. So kahit na yung statistics hindi pa pinapakita na napupuno, kung dumadaing na ang aming mga kasamahan, we will request for that. But I think we won't have to. Kasi sinabi na naman ng Malacanang that they are ready to call for a lockdown if necessary. And the LGUs are also ready. Many of them are imposing lockdowns to certain levels already. Yeah, siguro good to hear from one of our prominent and well-loved frontliners sa College of Emergency Medicine. Lend an ear to Dr. Pauline Convocar.
Gusto ko yung well-loved, sir.
Oh,
Namnamin ko po muna. Namnamin ko po muna yan. Good morning, everyone, and thank you very much for all of your questions. And looking at the specific unit in the healthcare system, taking care of these patients na pumapasok. So just a bit of an intro lang po talaga. The emergency unit kasi, or the department, is a sensitive area in the hospital because it's like a gateway to the healthcare system. So we receive patients coming from the community, and it has been always our battle cry that we may be the last ones to really cry out because anong nangyayari sa community when the patients are now coming in, we're the first ones to see the trend. So the question here is really on hospital occupancy. It's really palpable. Kita naman natin yung numbers. But it's also a different thing talking about what is the perception of the healthcare workers. Kasi iba yung load versus doon sa the numbers. Sa ngayon, nakikita naman natin na the numbers are really increasing. Occupancy, the beds are immediately they're full. So what's dynamic here is that, and the secret numbers is that in the emergency department, when there's no movement, we are in a very sensitive situation when kailangan namin talagang tingnan kung magpapalipat kami ng pasyente dahil hindi gumagalaw towards the end of the disposition part kasi hindi na-admit ng hospital namin. So yun yung hindi natin na-account relatively dun sa mga numbers na napapublish. Kasi ito yung sensitive numbers na yun nga falling through the cracks of the healthcare system. But the good thing is that we already have a system in place, and we learned our lesson for the past year din naman kasi, and we have our one hospital command who's supposed to take care of that. So tulungan po talaga yung paglilipat-lipat din, but there are those also who really choose to go to places and hospitals na hindi angkop. So yun yung pag nandun at hindi makakalipat, we'll know the dynamic and the severity of the problem when wala nang movement. So relatively ngayon po talaga, may mga ospital na nagpapaskill ng no vacancy, and that people are now left to looking for hospitals and facilities for themselves. So yun po yung gusto namin din na i-emphasize na dapat din people should know where to go and what number to call. Kung yung panawagan that you should also know that para po magawan din po tayo ng magandang guide as to where is the nearest facility to consult, and then saan po yung mas angkop po para sa inyo. Kasi yung mild pumupunta po doon sa level 3 that's not supposed to be there. And then the severe naman na pupunta doon sa level na hindi naman din angkop. So kailangan po nating alam, i-navigate po yung healthcare system para po ma-accommodate po lahat.
So thank you, Pauline. So yung response mo kasi is because you are an emergency physician, right, in the hospital. So nabanggit po ni Pauline yung one hospital command. Pero paano naman yung enabling or empowering the LGUs to take care of their own constituents? Maybe we can ask one of our steering committee members who is a public health physician, Dr. Lay Alfonso.
Ako ni Doc Dingdong. Salamat po dahil pinagdikit mo ulit yung bitukan namin ni Pauline. No? So from the community po kasi nanggagaling yung cases na to, how do we control the surge? How do we push back kung pumupuno na yung ospital? So from the hospitals po kasi karamihan yan, hindi nga po dapat nandoon. Yun yung isang dahilan. So we need to make sure na ang pupunta lang sa hospital yung mga kailangan nandun para ho hindi ma-overwhelm yung mga tao natin sa hospital, ang ER, pati ho yung ICU. So to push back, how? Go to the LGU, 90% of the cases will be mild to moderate. And they can be addressed at the local government level sa mga ating mga ligtas COVID facilities, quarantine facilities. And then I push back again, Nina, dun sa sinabi ko kanina, preventive is better than curative. So we need to make sure that the business sector and also the local governments are making sure that the enabling environments for the people para hindi na magkaroon ng transmission andoon. So it goes back from the hospital, pushing it down again to the community level. And we're not just talking about individual responsibility here, but it's a shared responsibility of the citizens, of the people, and the government. We need the government and the business sector to help us decongest the hospitals. Yun lang po.
Thank you, Lay. I'd like to read here some comments from Facebook. No, media daw sana to set example to wear mask and face shield and keeping distance kasi sila ang seen on TV. So any comment from our media friends? Okay. Well, it's actually 10:11 already. No, we plan to have this press con for only 1 hour. But if you look at the chat box for our friends from the media, meron po tayong press release dito that you can download and you can use. And a lot of you are also allowed to record this session. So, any last words from our speakers?
Sir, pasensya na. Pwede bang maghabol ng isa? Clarification lang. This is Maki
Sure.
Pulido. Dr. Dan, sorry po, clarify lang. When you were asked regarding the threshold, edi parang ang lapit na because based on the numbers that you gave, 80% dun sa ICUs ng mga COVID referral hospitals and 50% sa metro-wide ICUs. Edi medyo malapit nyo nang maabot yung threshold to the point na hihingi na kayo ng timeout?
We will reserve that call for now, and we will not hesitate to call for that kasi kuminsan hindi pa naabot ng statistics, nararamdaman na ng aming mga kasamahan sa front lines. So araw-araw ho namin tinatanong si Dr. Convocar, kaya pa ba sa front lines? Kasi kung sinabi nilang hirap na sila at marami nang nagkakasakit at pagod na sila, mauuna kami sa statistics. No? Hopefully, we will have the statistics will show signs that we need to lock down sooner rather than later. Mauna bago mahirapan yung ating mga kasamahan. May meeting ho sa Department of Health today at lalahok kami pag-uusapan ano bang pinakamagandang statistics na pwedeng tingnan at gawing gabay para magtawag ng intensified lockdowns bago nahihirapan ng ating mga kasamahan sa front lines. So tama ka, malapit na. Hindi pa sa ngayon. Pero nakikinig kami lagi. Araw-araw ho natin kukumustahin si Dr. Pauline. Kasi kami unang sisigaw ng tulong kung nahihirapan na sila.
Dr. Espina, any last words?
The next few days are critical for our country. Lockdown should be our last resort. It should not be our first option. Meron pa po tayong magagawa. At sana po, yung pinakita po naming mga aksyon na pwede nating gawin this morning ay maipatupad po natin. At kung meron po kayong naiisip din na mga magagandang solusyon na sa tingin ninyo ay pwedeng gawin now na, sana po i-share natin. Kaya po natin to. Matapang, matibay ang Pilipino. Naniniwala po ako dyan. Thank you, Ding Dong.
Thank you, sir.
I want to say some just as last words lang para lang matandaan ng mga tao at kaibigan natin sa press, no. Our biggest fear, when we fear this surge, we fear this pandemic. Kaya lang our biggest fear is that we leave this pandemic exactly the same way we entered it. Ganun pa rin. traffic pa rin, crowded pa rin, polluted. You know, the same things that will lead to another pandemic. No? Na ayaw na nating danasin pa ito ng ating mga anak at apo. No? Sayang kung yung paghihirap na dinanas natin, mga nagkasakit, nawalan ng trabaho, nagutom, mga kamag-anak at mahal sa buhay na namatay, sayang lang yun kung wala tayong natutunan at hindi tayo nagbago. Ganun pa rin yung lipunan natin after the pandemic. Ang pagbabago sa lipunan, malaking tungkulin ng mga taong bayan. Pero nasa kamay ito ng ating mga policy makers. Sana sila hong mas makakaisip ng paraan. Yung mga nabanggit namin today, mga ideas lang ho namin yan. Pero mas maiisip po ito ng ating mga governors and mayors and our leaders kung paano ba natin babaguhin ang lipunan para hindi na maulit ang pandemic na to, para hindi na ulit magkaroon ng bagong surge. So sana ho, humihingi kami ng tulong. Tama na yung pagbibintang sa mga tao. No? They are doing everything they can. Gumawa naman tayo ng paraan para madali sa kanila na sundin yung apat-dapat at iwasan na magkaroon sila ng infections. Yun po ang aming panawagan. Maraming salamat po. Ding Dong, your mic's muted.
Thank you very much, Dr. Tony. So we'll have to end the press con here and thank our media friends for attending. We hope we can all survive this surge at this time. Thank you, everyone.
Kaya natin. Thank you, everyone. We'll ask the steering committee members to stay behind, please.